In this article, authors from the University of Michigan, led by Dr. Kevin Chung, describe a technique for ligament reconstruction in the wrist using the internal brace technique. Ligament injuries in the wrist can be particularly challenging for hand surgeons, as these are not always evident on X-ray or MRI imaging. Some surgeons may use wrist arthroscopy in an effort to diagnose these injuries, and there are many different surgical techniques available for reconstruction with varying levels of complexity and varying levels of efficacy. In this Ideas and Innovations paper, Dr. Chung and his team describe the technical specifics and nuances of this operation and why he has adopted this technique in his practice. He performs this procedure through a single dorsal incision, which can be performed relatively expeditiously, even with harvest of a thin tendon graft from the ECRB. Overall, I found this article to be particularly useful, and I have similarly adopted this technique for most scapholunate ligament injuries with preserved articular surfaces. Dr. Chung's focus on precise placement of the drill holes in the scaphoid and the lunate is paramount, and his description of appropriate utilization of the swivel lock anchors is also critical. When this technique is performed well, the operation is almost always seamless, but it is technically demanding. For both experienced and relatively junior hand surgeons, this can be adopted in practice when treating these challenging injuries. This article does provide a relatively comprehensive template for surgeons to use when planning and executing this surgery. Although this is not a randomized trial or a manuscript filled with a ton of clinical evidence, the technical pearls articulated by a master of hand surgery are incredibly valuable and serve as the foundation for this paper's impact. I thank the authors for their excellent figures and their clear and concise clinical video about this technique.